As more states begin the vaccination exercise with the delivery of the Oxford AstraZeneca vaccine across the country, the National Agency for Food and Drug Administration and Control, NAFDAC, has warned the public to be wary of using fake COVID-19 vaccines not approved by it. NAFDAC raised the alarm to deter government agencies and private companies against ordering vaccines without its approval, noting that COVID-19 vaccines are new and the side effects or adverse events must be well monitored, hence should not be used by the public. Well, joining me via Skype from Kano is public health physician Dr. Usman Bashir. Good morning. Thank you for joining us on TVC Breakfast. Now, this concerns raised by NAFDAC has generated mixed reactions amongst citizens. But let's get your reaction to this development. Does it come as a surprise to you?
Yes, definitely. The process vaccines and taking care, but you know, there are so many and then in the process because of the but I feel with the barcodes and other technologies in place, fake vaccines can be tracked and picked up quickly.
But is there a way that we can put measures in place at this point to ensure that they don't even come into the country in the first place, considering the health risks this could cause?
Definitely, we can track that, because we know the logistical matters where the vaccine is conveyed to Nigeria and from the in-country to various states. As I can see every day, you see that planes, mostly I don't think they even use road transport. They prepare air transport, and whereby the state primary health care board is usually the custodian of the vaccines. And then the distribution button is usually at the PHC level. So I don't think there will be, the only aspect where we have problems is in the private, maybe where somebody will import it in as something else. But so far, the person imported a vaccine, like regulatory bodies like NAFDAC, Standard Organization Nigeria, and even the immigration officials and other health, port health authorities will make sure that these things don't come into the country.
Health implications, perhaps for a lot of persons to get to understand that we should get vaccines through the right channels.
Yes. And I'm very happy with the way NPSDA, that's National Primary Health Care Development Agency, have put on a website whereby you go and register. When you register, you'll be given an ID, and it is that ID that you go to those facilities that you are designated to or close to you. Usually, every ward has a facility depending on the state. So, and then you, even if there's no ward in your ward, there's no facility that has the full complement of services that will provide the services. They will post you to the nearest facility that's close to you. So with that, I think that has been taken care of, because when you go there, you have to give that ID before you can even be given this vaccine. And not only that, it has been started, as we know, is at work to receive the vaccine. So, so, and I'm sure even when you check the card, you will see there's a batch number. So with batch number, you can track what you are given. So even if the batch number, and then there's a barcode, and then they will synchronize that barcode with the batch number and your ID. So I don't think anybody that will think will just bring fake vaccine will have a headway.
Now, talk to us, before the vaccine was rolled out, we already see the attitudes of persons where there's been myths and other issues being raised, and people's attitude towards vaccine. And now we are having a situation with fake COVID vaccines that NAFDAC is raising the alarm concerning. Now, do you see this in any way deepening vaccine hesitancy, saying that we are right in the middle of administering vaccines?
Like I said earlier, I don't think it will deepen the essence, and then even the uptake is improving because people have realized most of those news they are reading are fake news, are unsubstantiated news by non-experts, people who just sit down in their homes and create malicious slanders and information that don't even make scientific sense. So I think people have realized this, and then, like I said, the fake vaccine people will likely have a headway. It is only those that maybe they want to shunt the queue, or they don't want to even register, or they want to go underground and have a vaccine. And please, they should be informed. They should follow the process, because if you follow the due process, you will not fall into the hand of these unscrupulous individuals who want to destroy the effort of the government.
Well, Nigeria is not the only country that is raising concerns with regards to fake vaccines. Some other countries, even across Europe, are talking about the fact that with the way registration is going on, especially using social media and other mediums on websites and all of it, there are persons who are exploiting this means to also carry out some other criminal activities. Now, as it stands, it's obviously a complex issue that has to be dealt with head on. But what do you see if nothing is done as quickly as possible to tackle this head on?
Yes, I think if nothing is done, it will really put a mar on the effort being made, as in the vaccine rollout, whereby nations and what we want to achieve, that is the herd immunity, in getting the vaccine, so that everybody gets a vaccine and then the disease goes away. So, but we hope that if government will put more effort, and then even the IT experts will put on more security on the network, so that there won't be any breach of data, breach of personal information, so that people will have confidence in registering and then getting the vaccine in the long run.
All right. Now there has been issues with regards to the side effects of the AstraZeneca vaccines, and this has been. We see some countries putting the administration of the vaccine on hold. Although Nigeria is said to not have received from that batch of Oxford AstraZeneca. What do you think government should be doing at this point to allay the fears of citizens who are yet to receive the vaccine?
Yes, even food has side effects, and side effects usually sometimes are mild, sometimes they can be severe. So, but like I said, when the side effects are being shared, people now know what are the side effects. Like, there's malaria, there might be headache, and then there might be even severe outcomes. So that's why when you take the vaccine, you're advised to stay 20 minutes after the vaccine and just wait, so that even if there's any adverse event, there's a team, what we call AFE, adverse event team, that will take care of that problem. And usually most of the adverse event will be taken care of. And so far we've not received any report of any adverse effect in Nigeria. And then those countries that are putting what do you call it, cautionary measures to make sure that is what happens. If you are introducing any drug or any vaccine, you must monitor and see if there's any problem, so that you can try and look at the process, whether investigate, find out whether it is really that thing is causing the adverse event, like the clotting that's it. If you see that the numbers are not even up to what is being seen in the general population, in our hospital setting, and in people along those age group, because most of the incidents are in people above 60. So we need to really find out whether is it the vaccine that is causing the side effect, or they must have an underlying illness that is triggering this effect. And without that, we cannot make any headway. So, and I think the Nigerian government has done well and have allayed the fears of Nigerians, have informed the public that this thing is working, and so far so good for Nigeria. So I don't think there's any fear. Like I told you, I've had my own vaccine, I've had my side effects, and they have all gone, and I'm doing well now.
All right.
And I'm waiting for
Public health physician, Dr. Usman Bashir, thank you for your time on the program.
Thank you for having me.